Thank you for choosing Greene Endodontics. Please follow the post-operative care instructions for your procedure and for the sedation. These instructions will help the patient during the healing process of their treatment and support a successful treatment outcome. We also want to review the safety precautions for sedated patients after the procedure. Safety is our top priority.
It is not uncommon for a tooth to be uncomfortable or even exhibit a dull ache immediately after receiving root canal therapy. The patient's tooth will be sensitive to biting pressure and may even appear to feel loose. This is normal. The patient may feel a rough area where the access was made and sealed with a temporary filling. The temporary filling seals and protects the root canal treatment from becoming contaminated and reinfected between appointments. Don't let the patient chew on the affected tooth or the temporary filling may come out. It is important to replace the filling. You can get temporary filling material at any drugstore or make an appointment with us or the patient's general dentist.
Please avoid eating for 6 hours or until the numbness has worn off. The patient can have a shake or smoothie once the sedation has worn off. Please monitor the patient to prevent choking. Place an ice pack on the cheek to calm swelling and soreness for 15-minute intervals. We recommend that you take over-the-counter pain relief medication once the sedation has worn off, such as ibuprofen and/or Tylenol. Please refer to the written post-operative instructions for dosage amounts.
Beginning in 24 hours, please have the patient rinse their mouth with warm salt water after meals and before going to bed. For the next 48 hours, please have the patient elevate their head during sleep with an extra pillow to reduce swelling. For the next 48 hours, please have the patient refrain from smoking, consuming alcohol, and excessively exercising.
Please continue brushing and flossing in all areas of your mouth. You have a temporary filling on your tooth. You must refrain from chewing on the affected tooth until you see your general dentist. Do not eat anything sticky or crunchy until after you get the final restoration. Your dentist will decide if you need a filling or a crown. Call your dentist to replace the temporary filling no later than 4 to 6 weeks. Please do not hesitate to contact us with any questions.
After treatment, a staff member will escort the patient from the waiting room to your vehicle. When you arrive home, escort the patient. Do not let the patient walk by themselves, and do not leave the sedated patient alone in the car unassisted. Patients must be accompanied by a responsible adult. Patients may sleep, but must be watched for at least 6 hours after treatment. For the next 24 hours, the patient is not to drive or perform any activities with legal implications or require dexterity or alert decision-making.
The patient should not drive a motor vehicle. Do not let the patient work with power tools or machinery. Do not let the patient go to work or school. Do not let the patient ingest alcohol for 48 hours after the procedure. Do not allow the patient to care for young children or pets while sedated. Please be mindful to assist the patient when walking up and down stairs. Thank you for choosing Greene Endodontics. Safety is our top priority. Please do not hesitate to contact us with any concerns.